Many active people who suffer a shoulder dislocation experience recurrent dislocations, and very often they require surgery. Is there a role for peptides, PRP, stem cells, or exosomes as a treatment option for dislocated shoulders? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Shoulder dislocations are a tricky problem. This is basically where the ball pops out of the socket. Almost always, well, really, just always a traumatic event that happens in sports or exercise, at least the first time, as it becomes a recurrent problem, which is very, very common, especially the younger you are. The first time you have a shoulder dislocation, it just starts popping out easier and easier. And that is why very, very often shoulder dislocations require surgery. Basically, the surgeon goes in, usually arthroscopically, and can reattach the labrum to the socket, to the glenoid, tighten up the capsule. Sometimes it requires more than that, moving bone around and all to basically reinforce bone loss. And there's a variety of technical things, especially when it becomes a recurrent problem, but very, very often it needs surgery. Now, would the regenerative treatments necessarily decrease the chance that it needs surgery? And that's where it's a little trickier. Sort of two different categories, peptides, and then we'll talk about some of the injections that the physician or orthopedic surgeon would do into the shoulder, whether that's PRP or exosomes or stem cells, kind of in a different category. As I always say in these modern medicine videos, all of these treatments are considered experimental by the FDA, and I am not promoting them, not saying that you should do them. I just want to put more information out there, hopefully of good quality based on scientific evidence and what we know so far as to whether they potentially be an option for you, so that you can go to your doctor, you could go to your orthopedic surgeon and ask more specifically if those treatments might be right for you. Peptides, medications that you give yourself, essentially, I think might help with the pain. I'd be hard pressed to explain how it might help reattach the labrum, tighten the capsule on its own. Yes, in animal studies, BPC has been shown to improve, especially Achilles tendon healing. I don't know that necessarily it would help much here. If for any other reason, I can't imagine it would have all that much effect with problems inside a joint, in this case, inside the shoulder joint, when you're giving them outside of the shoulder joint, whether that's even just in the deltoid muscle or under the skin, just outside the deltoid or in your abdomen or anywhere else. Can't imagine that it would help that much. Might help with the pain, but it's hard to know. Thymosin beta 4, TB4, TB500, I don't know necessarily how much that would be helpful either. If something in the regenerative space, regenerative orthopedics, was going to be helpful to try to limit the development of recurrent instability of the shoulder, I would expect it would be treatments injected into the shoulder, PRP or exosomes, stem cells, but they haven't been studied for that. I'm not aware of studies that show that it necessarily would help, but at least from a theoretical standpoint, could it help reattach the labrum? Yes, I'd still be honestly fairly worried that it's not going to tighten the capsule. There'd be a lot of laxity there that could lead to recurrent instability. So might not be really where I'd go. Now, if you were going to go through surgery, could treatments like that, like PRP or exosomes, maybe injected into the shoulder, help that repair, heal faster? Potentially. Again, hasn't been studied for that. Like I've talked in other videos where peptides could, going back to that, could be helpful, as if you're going to go through surgery, might help you recover from that surgery faster, getting your strength back. Again, recovery from that surgery, it's an hour-long outpatient surgery typically, or less than an hour, but it's a long recovery, minimum of 4 to 6 months before you're back to playing sports at a high level, depending on what you do. Could it potentially speed that? Yes, it might help you get your muscle strength back faster, help the tendons and ligaments that support that area get stronger. Obviously, I don't know that you need much more than physical therapy, but could there be a role for that? Yes. Hasn't really been studied, any of those, in the world of shoulder dislocation and shoulder instability, but that's where the theory of that comes from. But again, they're experimental, so definitely talk to your doctor. All right, I'd love to hear your experience with your shoulder injury, shoulder dislocation, or whatever the shoulder injury is, and especially if you've used regenerative treatments for that. Leave those in the comments below. Just understand, if you leave a question in the comments, I can't respond with medical advice. So what I do is I try to answer those questions in future videos. Make sure to subscribe to this channel. Click the bell to be notified when I release a new video and when I start my live streams, the Ask Dr. Geier live shows. Thanks so much for watching. I look forward to helping you feel, look, and perform better than ever.